Hello, everybody. I'm Dr. Veronica Riera-Gilley, your holistic and functional medicine pharmacist, and I'm joined again by Quyen Johnson, family nurse practitioner at One Family Clinic, and we're here to talk about colon cancer. March is Colon Cancer Awareness Month, and we wanted to bring you some important information on why you should get screened and some of the risk factors for this because it's something that's very treatable when it's caught early enough. So, Quyen, what can you tell us about colon cancer and some of the risk factors?
So, colon cancer is a disease in which the cells of the colon or the rectum grow out of controls. And sometimes this growth is called polyps. It's grow very slowly. And so, if patient can get screened earlier in the process and the polyps can be taken away, then it helps it keep it from turning into cancerous. So it's very important that people do their screening at an early stage when this happen. Some of the risk factor for colon cancer usually include people that have inflammatory bowel disease. They seem to be more at risk for having colon cancer. People who have a personal or family history of colon cancer or polyps, of course, and a lack of exercise or physical activities. And then if their diet have high in processed food and low in vegetable and fruit, then it's also contribute to the risk of having colon cancer.
So, something we hear a lot every time you and I get together is that we need to eat more fruits and vegetables. The foods that we eat play a big role in our health, and low fiber foods can increase our risk of having colon cancer because we're not getting enough bulking in our gut to give us that signal that we need to move things out so we're not pooping as often. And pooping is like taking out the trash, and it's really important that we do it every single day. If we don't, we get reabsorption of things that were on their way out the door, but our body says, hey, this is still here. Maybe I should use that. And we actually reabsorb some things that we were intending to take out with the trash. I bet Quyen has a patient right now, so I'm going to keep chatting until she can rejoin us. Screening for colon cancer can be done with a colonoscopy, which is a procedure where you drink medication or over-the-counter product or take prescription tablets that help draw a lot of water into your bowel to flush out the contents. So there's nothing in there. It's squeaky clean. And then under sedation or medication that makes you very sleepy, they can use a scope and a camera to take a look and take pictures inside of your rectum and your colon. Sometimes during that procedure, if they find polyps or those suspicious areas, they can take them off and take them for biopsy during that procedure. There are other methods of screening for colon cancer, like looking for hidden blood in your stool, and this can sometimes be done with a little test strip that you add to the toilet bowl, and it will look for hidden blood in your stool. Since blood in our bowel movements can be an indication that something is wrong and needs more attention from our physicians. Not everyone is a candidate for these at-home colon cancer screenings, and there are even genetic type tests that can give us information about colon cancer, but not everyone is a candidate for those. So be sure that you have a regular provider that you're seeing, and you can talk to them about which test is right for you based on your family history and other risk factors that you may have. It's important that everyone get a colonoscopy every 5 to 10 years, starting at age 45. It may be earlier if you have other risk factors or family history, and it's important to maintain that regular screening process because the earlier that we can catch a cancerous process that's happening, the more likely we are to survive it long term and that it doesn't have the chance to spread to other organs. When cancer spreads, it's also known as metastasis, and it becomes much more challenging to treat. So, the earlier we can identify these cancerous cells and make sure that they're isolated in just that one local part of the body, the better your chances of survival. And I'd like to share a survival story with you of my grandfather. He had colon cancer and he caught it very early. He had surgery to remove a small section of his colon that had the tumor, and he lived for many years after that. And he died in his 80s of pneumonia instead of cancer. So I hope that's a good story for you to hear of a positive outcome of a patient that had colon cancer. Do you have any stories to share with us, Wynn, about your patients and any success stories with an early screening process?
Oh yes, I have many patients who, who went through the screening and found polyps, and the polyps get cut off. So, I have many patients who told me their stories about that. And then on the other side, I also have patients who, for one reason or the other haven't done the screening in time, and unfortunately, by the time they get, tested for some problems, it's turned out that they get colon cancer. So I have seen, both sides of the problem.
If we have a change in our bowel habits suddenly, that's another reason that we might want to get screened earlier rather than later, is if something isn't normal and we have a big sudden change, either lots of constipation when we didn't have it before, or diarrhea that doesn't seem to have another cause, or maybe we go back and forth between constipation and diarrhea and abdominal discomfort. When there's a change in those bowel habits, speak up to your doctor and find out what's going on.
Yeah, and colon cancer can be quite deceptive. I have patients who have back pain, but that's all the symptom they have is back pain. But their bowel movement seem to be okay, everything seems to be okay. But by the time we find out, it's actually the colon cancer that causing the back pain.
That's
So
pretty
it can be
amazing.
quite deceptive.
Yeah, it's amazing how anything in our abdomen can mask as something else. I will share a personal story. It's not related to colon cancer, but I had a tumor on my uterus and it was pressing on my bowel, causing all kinds of constipation and cramping and other symptoms that seemed like it was all bowel related. And it turns out it was a tumor on my uterus. So don't ignore these symptoms, get them checked out, and make sure that there's not something else that's causing the problem, since sometimes it can be hard to distinguish.
Exactly.
When I talked about some screening while you stepped away, I talked about the endoscopy procedure where people get a sedative medication, and it's after they've done that lovely bowel prep that causes everything to be flushed out so they can get a beautiful clean view inside their colon. And I talked about the test where you can drop the testing paper in the toilet bowl to look for the hidden blood. Are there other procedures or ways to get screened for colon cancer that you want to tell us about?
Usually for screening, there are stool tests, and there are sigmoidoscopy or colonoscopy tests. For the tests used in the stool, they check for blood in the stool, even a minute amount. And so, that should be done once a year. And then for the sigmoidoscopy is when the doctor check the lower third of the colon. That should be done every 5 years. And for the colonoscopy, is when the doctors check the entire colon, and that should be done every 10 years. And they have used to be the age to start screening for colon cancer, it was 50, but recently that will lower to 45. So adult age 45 to 75 should be screened for colon cancer. And the reason for that is, because there is an increase, in the colon cancer in the U.S.
Which probably has a lot to do with our diets. It's estimated that 90% of the chronic illnesses that we deal with, like diabetes type 2 and heart disease, are linked to our lifestyle habits and the foods that we eat. And it's nice to know that the things that we're doing to help our heart health and our blood sugar health are also going to help our colon health, because eating a diet rich in plant foods, plant fibers, is going to help us move things out more frequently. When we eat a lot of plants, we poop more, which is good. We want to take out the trash every day.
Absolutely.
What other advice do you have for your patients in regards to their gut health?
I think we have another thing that I probably haven't mentioned is alcohol consumption and tobacco use. Those things should be avoided, of course, for our gut health.
Yeah, tobacco and alcohol have such an impact on multiple body systems, our lungs, our liver, and our colon. So when we can minimize those, it definitely helps to decrease our cancer risk when we're not having that constant toxic exposure that our body has to deal with. The more insults or toxic things that we put in our body, the more cleanup our body has to do. And we don't have those cleanup resources available to focus on things like cancer cells that have gone rogue. We're busy over here trying to clean up the alcohol and the tobacco and the processed food that we ate, instead of, ooh, let's shut down the cancer cells. Our resources are going other places. So we can really help our body and give our resources to cleaning up cells that are misbehaving instead of cleaning up our diet and other environmental exposures. So I think that's a really great point to bring up, that we can really boost our health just by minimizing those things. We're not saying never drink alcohol, but moderation is key.
Yes, yes.
Well, anything else we want to share with our patients before we wrap up today?
Another thing that I should bring up is nowadays, because since I talked to a few gastroenterologists in the area, and most of them have the direct access colonoscopy. So, if patient have insurance, they can call and schedule for the colonoscopy directly without having to have an office visit with the GI doctor before that procedure. So I think that speed up the process. So,
That's
usually,
really great.
yeah. So usually, patients, you need to give the office a call, and everything else will be taken care of, and they just go straight into the colonoscopy.
So our patients don't have an excuse. They can't say, oh, I haven't seen my regular provider, I haven't done this. They can call a GI doctor and say, I would like this direct access colonoscopy because I want to get screened and find out if I've got anything going on in my gut.
Yes, exactly.
That's awesome.
Yes.
I think that's really good information to share. Thank you, because I didn't know that there was any direct access for screening like that. So that's that's great that it just removes one of those barriers for our patients to getting that care.
Yes, yes.
Well, thank you for joining us today and for listening to our health tips. If you need a good family care practitioner, please go see Quyen at her clinic, One Family Clinic. They take excellent care of people and they offer primary care, urgent care, IV therapy. What else am I missing, Quyen?
Weight management.
Weight management. Yes, your weight loss clinic is awesome. And I'm also available to help support your patients in the weight loss clinic if they need some additional health coaching support. I'm available
Yes,
to support patients in your program.
that's
So
wonderful.
thank you. And if you need medication therapy management services or functional medicine care, please give me a call and you can book an appointment on my website, prairiefirerx.com. And will you give us your website information? Because I know we can schedule online with you too, Quyen.
Yes, our website is onefamilysherman.com.
Very good. Well, thanks again, and we'll see you next Friday.
All right. Bye.